use the script on my phone?
Yes, that's great. All right, we'll give people just a minute to jump on. Thank you for joining us. Welcome to the workshop, Mental Health Causes for Behavior Change During a Pandemic in Adolescents and Adults with Down Syndrome, part of the MDSC 37th Annual Virtual Conference. You're welcome to type questions into that Q&A box, and we will address them at the end of the presentation, time permitting. And now it is my pleasure to turn it over to Jennifer Guan, who will introduce our speakers.
Hi, my name is Jennifer Guan, and I am happy to introduce our speakers, Dr. Brian Chicoine and Dr. Katie Frank. Brian Chicoine is the Medical Director of the Adult Down Syndrome Center in Park Ridge. He is on the faculty of Family Medicine at Advocate Lutheran General Hospital. Dr. Chicoine is co-founder of the Adult Down Syndrome Center, which has served over 6,000 adolescents and adults with Down syndrome since 1992. Dr. Chicoine graduated from Loyola University of Chicago Stritch School of Medicine and completed his family medicine residency at Lutheran General Hospital. He co-authored 2 books, Mental Wellness of Adults with Down Syndrome and A Guide to Good Health for Teens and Adults with Down Syndrome. He has provided medical care for adults with intellectual disabilities for over 30 years and has presented and written extensively on caring for adults with Down syndrome. Katie Frank is an occupational therapist at the Adult Down Syndrome Center in Park Ridge. Dr. Frank received her occupational therapy degree from St. Louis University and her doctoral degree in disability studies from the University of Illinois at Chicago. Most of her work has been with individuals with Down syndrome of all ages. Dr. Frank has experience with treatment and evaluation as well as facilitating groups for people with Down syndrome, conducting trainings for staff, families, and caregivers, and offering a variety of other educational opportunities across the United States. Her research is published in peer-reviewed journals.
Thank you, Jennifer.
You're welcome.
Appreciate that introduction. As Jennifer introduced, I'm Brian Chicoine. I'm the medical director of the Adult Down Syndrome Clinic. And Katie and I are going to talk today about mental health causes for behavior change during a pandemic in adolescents and adults with Down syndrome. As we look at this, many families and individuals with Down syndrome have done tremendously well during the pandemic. So we will certainly highlight some of the challenges, but also look at some of the things that people have done to really do well in this last year plus as we've gone through this crazy time. So just as a disclaimer, that we're providing educational information for educational purposes, not looking to substitute for your healthcare providers. But certainly feel free to share this information with your provider if you would find that helpful. So our mission is at the center, that's our clinic there, is to enhance the well-being of people with Down syndrome who are 12 and older by using a team approach to provide comprehensive, holistic, community-based healthcare services. And as was mentioned, we opened in 1992 and have seen over 6,000 adolescents and with Down syndrome. Just to put you in perspective, Park Ridge is where the arrow is. Lake Michigan is to the right, to the east there. Downtown Chicago is south and east, about 25 miles. And then O'Hare, we're about 5 miles from O'Hare Airport, just north and east of O'Hare in the Chicago suburb there. In addition to providing patient care, prior to COVID, we offered a range of programs in the center, including Zumba, Nature Club, social skills classes, music group, and art group. And we continue to offer as much of that programming as possible virtually. And Katie will talk some about that as well, who primarily manages that part of our mission. And again, educational presentations as well, such as this one. I will refer to our online resource library periodically through the talk. And that's the homepage there on the right. And you can see that the information is divided with focus on 3 groups: individuals with Down syndrome, families and care providers, and then healthcare professionals. Most of the resources for individuals with Down syndrome are video or in picture format. So it covers a wide range of reading ability or lack of reading ability. And all the health promotion videos, all the actors and actresses have Down syndrome. So that's really a peer modeling approach that we take with that. Again, a wide variety of videos, articles, booklets on a wide range of topics, and we're continually updating that information. So this afternoon, we're going to try to work on defining behavior change. We're going to identify reasons for behavior change during COVID, and then we're going to discuss some strategies and the solution to address these behavioral changes. Now, I think it's very important, you know, that our approach and you know, to just kind of get a sense of where we're coming from. We strongly believe in the World Health Organization definition of health and well-being, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so really is really looking at well-being and from a broad standpoint. And we are strong believers that mental health, physical health, and social health really do interact and intertwine, and really addressing one helps address the other, and not addressing one, unfortunately, affects the other. So really, it's you got to look at all 3 areas and address all 3 to try to promote health optimally, and to assess for when there's a change in health as well. So I'm going to see if I do this correctly and hand this over to Katie.
I got it. Thank you, Dr. Chicoine. So we do want to address briefly what we mean by behavior change, but we understand that there have been other talks on behavior this weekend, and so we're not going to focus solely on behavior. Except that it's not, there we go. It wasn't letting me advance. I apologize. So everything we do is a behavior. But a behavior change is a new action or pattern of actions that are atypical for an individual. But we should also look at a behavior change as a form of communication. So clearly that individual is trying to communicate something to us, whether it's pain or you know, some other aspect when we see that there's a behavior change. And sometimes when there's a behavior change, it's actually wanted or warranted. But other times it can be less than preferred. And we see that during COVID-19, there have been a variety of causes for behavior change. And it could be that there's just a change in routine. So individuals aren't going to school anymore or aren't going to work. They weren't able to participate in activities outside of the home. And that really can impact individuals with Down syndrome who crave structure and routine. We also saw changes in behavior because of grief and loss, and maybe not because of death of someone, but just the grief and loss of these changes in routine and the lack of ability for social participation. So not seeing family and friends. And that led to social isolation, which is also a reason during this time for behavior change. Perhaps there was family or personal illness. And again, maybe with COVID, but perhaps some other illness that they had to deal with that could lead to behavior change. And then for many of us, there's this huge news overdose. I mean, the news has not been positive over the past year. And there's been a lot of news about COVID and all the other things that have been going on, and it is really overwhelming. And individuals with Down syndrome are able to pick up on that. They do understand so much more sometimes than we believe that they can. And so if we have the news on, the information that they're hearing can impact their behavior. Also, changes in diet can lead to behavior change, and whether those are good or bad changes in diet. There's been a lot of family stress over the past year, and again, that can impact someone with Down syndrome. And then just the lack of physical activity. We also know that individuals with Down syndrome have something called empathy radar, where they have a strong ability to feel the emotions of others. And so many of these, other causes that we talked about, whether it's grief and loss, the family or personal illness, the news overdose, the family stress, all of that can play in to the empathy radar of someone with Down syndrome and impact their behavior. So Dr. Chicoine and I really want to present some clinical examples to you to show the behavior changes that we've seen through a variety of patients this past year, and then some of the strategies we used to help with this. So in the first example, there's an individual with Down syndrome who experienced a change in sleep habits where he wanted to sleep all day and stay awake at night. Because of COVID, there were obvious changes to his routine and living situation. He had siblings now living in the home who weren't living there before. He wasn't going to work. His parents were working from home. He also couldn't go to his activities. And it really impacted him and led to social withdrawal. So he didn't even want to interact with his family or participate in one's preferred activities in the home, which was unusual for him. That was the behavior change. And so they made an appointment with Dr. Chicoine, and he really tried to address the physical and mental health causes for this change in behavior, but realized that no medications or treatments were really indicated. And so he made the referral to me to see if there was something I could do to help, and whether it was establishing new routines for this person using visual supports, or also seeing if some sensory strategies would help this person, want to have more routine in his day and a better structure. So I did end up creating some visuals for this patient. And these are some examples of a visual that could be made, and whether it's showing them that if they have something to look forward to, then they're probably going to want to get out of bed. So we saw that if we gave him the opportunity to know that he was going to eat and go to the bathroom and brush his teeth and do all these things after he woke up, it might be that extra little motivation he needed to get out of bed. And then he also had an evening routine, which built in some social opportunities with family. It incorporated physical activity, all of these things that he was naturally lacking. And we would give him choice of what he wanted to participate in. And really, one reason this was so important was because COVID impacted everything so quickly. And we weren't really able to prepare individuals for the sudden change. And we didn't know how long it was going to last. And, it made it hard for everyone, and especially for individuals with Down syndrome. So another strategy that can be used to help with sleep hygiene, or to help with sleep, is creating good sleep hygiene, which is a series of healthy sleep habits that can improve the ability to fall asleep or stay asleep, but it's also refraining from activities that promote excessive evening alertness or interrupt the natural process of falling asleep. So Dr. Chicoine had mentioned that we're going to reference our resource library throughout this presentation. And in the handout that you all have access to, you can click on the links in the PDFs, and it will take you directly to the links that to the resources we're talking about in the resource library. But so with this example with sleep hygiene, it's important to go to bed at the same time every night and wake up at the same time each morning and get 7 to 9 hours of sleep each night. Make a good sleep space. So a good sleep space doesn't have a TV, a tablet, or a phone. And then also having a healthy bedtime routine, whether it's a hygiene routine, a relaxation routine, or a combination of both. And while this particular resource is for the individuals with Down syndrome, I'm fairly certain most of us can learn from this resource because many of us probably are not creating a good sleep hygiene routine for ourselves. And so it's a nice reminder for everybody. There are also additional strategies to facilitate better sleep. So whether it's a sound machine to have white noise, wearing earplugs, perhaps having a sleep mask if there's a lot of extra light in the room. There's a variety of different alarms that can be used, whether it's an alarm that lights up gradually to wake you up instead of blaring a beeping sound, or a different type of alarm that just notifies someone that it's okay to get out of bed. Some people are warm sleepers, and so having a fan blowing in the room can help with body temperature. It can also help with white noise. And then a physician may even suggest medications to help with sleep. But with this person, we also wanted to address sensory strategies to help him with self-regulation. And we know that difficulty with sensory processing can lead to behavior changes. And I want you to think about your sensory system like electrical wiring. Here, the wiring is intact and the light remains on. There's no interruptions in the messages being sent from the brain to the rest of the body. But when there is a kink in the wire, it may cause the lights to flicker. And sometimes we get a kink in our central nervous system, which leads to mixed messages being sent throughout our body. And many times, we may not even know what is causing the kink or how to stop our own internal lights from flickering. When sensory processing is disorderly, the brain cannot do its most important job of organizing sensory messages. And it may feel like fireworks are going off in our body or ants are crawling on our skin, and this can impact our behavior. So we have some suggestions for calming sensory strategies that include proprioceptive input. And our proprioceptive system is the awareness of our body in space. And when we provide proprioceptive input, we provide input into our muscles and joints to help regulate our body. And so here you can see pictures of a weighted snake on the left, just a regular massager, that one doesn't vibrate in the middle, and then one of our weighted blankets in the bottom right-hand corner. So natural opportunities for proprioceptive input may include exercise and physical activity, doing chores around the house like vacuuming or sweeping, wiping down counters, taking out the trash, and even dancing is a great form of proprioceptive input. And at the beginning of the pandemic, most opportunities for natural exercise and physical activity were removed. So again, here are some resources that we have available in our resource library. The one on the left just talks about what proprioceptive input is and how you can naturally incorporate it throughout the day. The one in the middle has some equipment recommendations for affordable sensory equipment, because if you were to look at sensory equipment in a catalog, it is ridiculously expensive. So there's just some alternatives there on that handout. And then the one on the far right is joint compression, which is just an easy way. It's like a little mini massage to help someone get some proprioceptive input in a short amount of time without any equipment. Now, it's important to note something here about weighted products, especially weighted blankets. First off, it is recommended that weighted products like a blanket should be 7 to 10% of someone's body weight and not more. However, it can be less if that works best. But many commercially offered weighted blankets advertise weights that are more than the suggested 7 to 10%. So for instance, in this example, you can see that the range is 14 to 26% of someone's body weight. So please do not refer to the weight suggestions when choosing to purchase a weighted blanket. Just remember that 7 to 10%. It is also highly recommended not to sleep under a weighted blanket, especially if there are concerns with seizures or asthma, sleep apnea, or cardiac issues, which are all common medical conditions in someone with Down syndrome. However, a weighted blanket could be used as part of a bedtime routine in order to calm before falling asleep. So it could be part of your sleep hygiene. It's also best if weighted products are used with supervision just to ensure safety. And then the other reason why it really isn't beneficial to sleep under a weighted blanket is that sensory input should be given for short periods of time, upwards of like 20 minutes. So for those of you that wear reading glasses, or maybe you take your sunglasses and you put them on the top of your head, after a while you forget they're there. And that's because your body, once it realizes that something isn't causing harm or pain to you, tunes it out. And it's the same with sensory input. So that's why occupational therapists often recommend short periods of sensory input intervals throughout the day instead of long bursts. And then here is our second example. And this one is actually a really positive example. So we had this individual who had been living independently, and because of COVID ended up having to stop work, and then she even moved back into with her family. And so we were really concerned about possible grief and depression from loss of independence and her ability to work. But the family ended up taking this as an opportunity and looked at it as a positive. And so they had more time to focus on health. So they focused on healthy eating and then actually having this individual cook her own meals at the family home. She was able to stay socially engaged through virtual opportunities and spent more time exercising and just had that family support. So we didn't really have to do anything, but we wanted to share some resources that we have in our resource library that were beneficial for this family. So again, you'd be able to click on the healthy eating resources and more than these three come up, but we have tips for eating healthy meals, and ways to incorporate fruits and vegetables. We have healthy snack ideas. We have, a variety of videos about healthy eating and the different food groups. We also know how important hydration is. And so we have some hydration resources, and these are just two of them. We have a video about staying hydrated and how much water you should drink. And then we have visual supports that go along with those videos. And Dr. Chicoine mentioned that before COVID, we were offering a variety of social skills groups and other social opportunities at the center. And just like everyone else, when COVID hit, we had to figure out how to offer these virtually. And so we run at a minimum 8 different groups virtually a week from the Adult Down Syndrome Center. And we've gotten a lot of experience running these virtual calls. So we've created resources to help others be able to do the same thing. So whether it's tips for successful video calls, we have a whole resource on Zoom and how to use it and Zoom etiquette. We do different social skills groups on conversation skills and managing emotions, and a music group. And then we do online social where we do an alphabet show and tell each week, just to give individuals opportunities to participate and to see each other and to get that opportunity for social participation. And then we all know that physical activity is important. And so we have a variety of resources on different ways to incorporate physical activity throughout the day. And these are just 2 of them. But if you were to click on that link, you would be able to access all of our resources on physical activity. And so with that, I am going to pass it back to Dr. Chicoine.
Thank you, Katie. So, Katie talked a lot about social skills and we feel that's so important with regards to good health promotion, because when someone does not have those social skills, it really can lend itself to causing some significant mental health issues. So that's something you'll hear us talk about frequently, not only today, but at other times as well. So I'm going to present another individual that we've seen during the pandemic. And again, most of our examples are sort of a conglomeration of people, so they're not all about one individual, but they're sharing the things we've learned from seeing different individuals with challenges. So this person was an individual with Down syndrome, presented with psychotic-like symptoms, was having some hallucinations, she had imaginary friends in the past, but she really coexisted with them very, very nicely. But now she really was, they were bothering her, and they were um, doing things that she didn't like. And this became a real challenge for her and her family. And she had also long-term used self-talk as a tool to help her with uh, just get through her day, to run through through things that had happened, to kind of talk through things that upset her, to prepare for the rest of the day, etc. And that had been a really a fairly positive thing in her life, and she knew that this was something that sometimes other people could find uh, disruptive or disturbing, and so she would do it in her room. But that changed significantly as COVID progressed, and she wasn't able to participate in activities, and she in much more social isolation, was not able to see other family members. And so that dramatically changed, and again, it became um, more punitive, if you will, towards herself. You're not doing things right. You're not you're not a good person, that kind of thing. But also talking to these imaginary friends in a negative way as well. So that definitely a significant change in this person as COVID progressed. So we looked for other medical issues and did not find any, and talked to the family and to the patient, and so we decided to do a course of medication because this was so disturbing. And so we started this individual on risperidone, which is an atypical antipsychotic, and it really significantly helped with the hallucinatory type behavior that she was exhibiting, and it significantly improved. And the family then continued to work with her, utilizing strategies for anxiety that had worked in the past. So as COVID had progressed and these other symptoms had been developing, the strategies that they had used in the past were not working. And so it just kept getting worse and worse. That with the medication, and often as I look at a medication, to really go in together with to be used alongside those strategies, not just to replace those strategies. So as hallucinatory behavior improved and she felt better, then she was able to respond to the strategies that the family had and she had used successfully for a long time. Other things we did in addition, we talked about as Katie mentioned, was we really recommended avoiding the news. It was clear that part of her challenge was that she was absorbing a lot of what is around, and she does chronically. But now there was so much, concern and bad news about the virus, and she was very concerned about that, and she was it was causing a lot of anxiety. And similar to what Katie talked about with the others, they developed some picture schedules to try to build a new routine. Loss of routine was a significant problem for her. She tends to be routine oriented, as many of the individuals with Down syndrome we see are, and she had lost that, and so again, she and her family built a new routine with picture schedules that was really very helpful. And again, unfortunately, initially she was having difficulty doing any of those things because it had gotten to a point where she really had developed this psychotic-like reaction to the stress and wasn't able to respond to the efforts that she had been able to respond to in the past. And again, she and her family found alternatives to activities that she could not do. The things that she was no longer able to do that she would have typically been doing. They found a lot of alternatives, some of it virtual, but some new activities that they were able to do during the pandemic, again, to develop a new routine. So after a period of time, the family wanted to try to stop the medication because she was doing so well. But unfortunately, the symptoms returned. And again, she was struggling to be able to respond to all the other efforts that were being done. And so the medication was restarted, and once again, the symptoms improved. The stress is still there, of course. Unfortunately, we are not out of this pandemic yet, although we're heading in the right direction, it looks like. But certainly she and her family's approach to using new approaches or alternative activities is very important. A couple months ago, I read an article in the New York Times that talks about the folks. This was not about people with Down syndrome; it was just in the rest of the population, or in the whole population. The people that are doing the best through the course of the pandemic are able to find new routines or make new routines. And again, I think that's certainly very true for the individuals with Down syndrome that we see as well. And so finding alternatives or making alternatives has been very important for most of us. And Katie talked about grief, and some of the grief is just the grief of the loss of our typical schedules and our typical life. And so trying to find ways to replace that is so important. So, really throughout this pandemic, we've seen a number of folks with a number of mental health issues, and some of them could be triggered by COVID, but certainly some could be for reasons other than COVID, just part of everyday life, that some individuals with Down syndrome will develop mental health issues. Certainly the stress of COVID and all the things that Katie talked about certainly are huge potential triggers for lots of people with or without Down syndrome. But certainly assessing someone for depression or anxiety or obsessive compulsive disorder or regression syndrome goes by, there's no formal name for that yet. You may have heard about this with typically in the range of age 15 to 25, but certainly both younger and older can get it. This situation that seems to be separate from autism in the young children and separate from Alzheimer's disease in the older individuals that they might develop. It goes by a number of different names: regression syndrome, Down syndrome, disintegrative disorder, and others. Again, that's something that could potentially have occurred in the last year as we've gone through this, possibly triggered by COVID, possibly not. Certainly situational stressors and the grief and the loss that we've talked about. We didn't talk about, could some of this be actually really directly triggered by COVID? What are the impact of having the virus, of getting infected on behavior change? We certainly know in people without Down syndrome that they're what some people are calling long-termers, where some of these folks are having a long-term or ongoing problems after the rest of the symptoms have resolved, of mood changes and neurological symptoms and others. And how does that affect people with Down syndrome? I don't think we really have an answer to that yet, but it is something to consider. So really trying to assess whether this, as we're seeing these changes, is this simply just someone simply being sad, or has the person developed depression? Is this someone worried, or have they developed an anxiety disorder? So that really can take some investigation and working with a healthcare provider to try to sort through that. And certainly all those strategies we talked about are important to try to help with that. But sometimes individuals will need something additional, with perhaps some medication or counseling. And certainly doing that, a lot of that we're been able to provide virtually or through video visits or in person as is appropriate. We do tend to see individuals long before COVID, but have what we call the groove, or the tendency towards sameness or repetition, tending to do things same or similarly over and over. And that can be a very good thing. It can help people really function better and can help them get through their day and do a lot of tasks. But sometimes it can become more of a problem and be more consistent with obsessive compulsive disorder. And so in that situation, it's really something that they are doing despite either not wanting to do it or being uncomfortable doing it, because it is no longer in their control. And that certainly is something that we've seen some individuals, as they've lost their structure, they've lost their schedules, really kind of seek to improve or restart grooves or develop new grooves, and then sometimes, unfortunately, it kind of goes beyond a healthy level and becoming something that needs more attention, again, possibly with medications. So we do have a number of resources on managing stress and anxiety on in our resource library. And again, most of the information for people with Down syndrome is in picture or video form. And the picture there in the middle of the two women sitting on the couch, that's a delightful video that they agreed to do with us or for us. They talked about how they manage their stress. This was done before COVID, but all the things still, are still all fit in the pandemic as well. But a number of strategies to help the individual calm down, control anger, and a variety of other strategies. And again, I think from an independent standpoint, what these handouts or what these visual depictions, what they do is they really do help the individual be able to manage these stresses and the anxiety more independently and under their own be part of the decision to do that on a daily basis. And so really kind of giving the individual a bigger role in that is so important, not only for just to give them the sense of controlling their own life, but also if they are living more independently, to make sure that that's something that they can do. And the fourth example is an individual with Down syndrome who had, during the pandemic, working with her neurologist, had her seizure medication changed, and so had been started on valproic acid or Depakote or Depakine, and I was the family reached out to me and said that the person was experiencing increased agitation and an unsteady gait or difficulty walking, and we went back and kind of looked through that, and certainly they were concerned that maybe this was related to the stress of COVID, and we certainly agreed that that was probably part of the issue. But as we looked at having had started this new medication recently, I suggested that with those symptoms, we should draw not only a medication level, of valproic acid level, but also check an ammonia level, which is something that can become abnormal in a person with that's on valproic acid, and can cause drowsiness, unsteady gait, and even agitation. And sure enough, this individual had this side effect. And in working with a neurologist, the medications were changed again and had a significant benefit. So, just really addressing any change as we go through this, we want to be careful not to blame everything on COVID, whether it's the virus itself or whether it's all the changes that we're dealing with through the pandemic. Unfortunately, or fortunately, depending on how you look at it, lots of other health issues are still out there, and we need to make sure that we're looking at those as well. So in this individual's case, like anyone, we want to make sure they get a good, thorough history and physical. And we ordered a variety of blood tests, including the ammonia level. And again, the ammonia level is a side effect of the valproic acid. Talked with the individual's neurologist and changed the seizure medication. The ammonia level went down and the symptoms improved, but unfortunately didn't resolve. And so we still had to address that. And some of that probably was related to COVID, the person has not had the infection, but just the stress of all of the changes that we've talked about. But certainly want to look at other causes, particularly things that are more common in people with Down syndrome, that can contribute to anyone to have a change in mental health. We talked about early on about the interaction between mental, physical, and social health, and this is something that we look at on a daily basis. I think about all the time. What underlying physical health condition could be contributing to the mental health condition, and so whether it's sleep apnea, which is the pauses in the breathing while sleeping, which is significantly more common in people with Down syndrome. And we've seen this present in all sorts of mental health ways, mental illness ways, from depression to anxiety to psychoses to attention deficit. So really thinking about sleep apnea as a contributing cause is often very important. We've seen vitamin B12 deficiency, which could be related to someone having celiac disease, but may also have an autoimmune component. And we know that autoimmune conditions, which is are conditions in which the body's own immune system attacks some part of the body. And so vitamin B12 deficiency sometimes is associated with autoimmunity. And we know that really in anyone, it's not unique to people with Down syndrome, in anyone that's has a vitamin B12 deficiency can present with neurological or psychological changes. Celiac disease, the sensitivity to gluten, the protein in wheat, barley, and rye is more common in people with Down syndrome. And I think that there's, certainly causing the vitamin B12 deficiency or other nutritional deficiencies could certainly contribute to mental health issues, but also just not feeling well, which I think a lot of people do with celiac disease, can contribute to mental health issues, particularly if it's a long-term undiagnosed condition, which unfortunately it often is. And vision and hearing impairment, we do know that both of those are more common in people with Down syndrome, particularly at a younger age. And those can cause significant mental health issues. Several years ago, this before COVID, I had seen an individual in his early 40s and did the exam. He was doing fine, no evidence of any eye conditions. And then he came back a couple years later there was a lot of concern that he had developed Alzheimer's disease. And unfortunately, in the 2 years, he had developed cataracts, and they, as happens in some people with Down syndrome, they had progressed pretty rapidly. And so a major part of his problem was that he had declining vision secondary to cataracts, and addressing that, really got him back to his baseline level of functioning really pretty quickly. And hearing the same way, we see a lot of individuals that the concern is that they're having a behavioral issue because they're not paying attention or they're not following directions or whatever the case may be, when it actually is hearing impairment. Hypothyroidism or an underactive thyroid, again, is something we know is more common in people with Down syndrome, perhaps as much as 40%, or as frequently as 40% of the individuals. And certainly we know that, some of the symptoms of hypothyroidism include depression and lethargy and fatigue. And much less common than hypothyroidism, but more common probably than in the rest of the population, hyperthyroidism or overactive thyroid can cause more symptoms like anxiety, but also fatigue and agitation and things. So again, thinking thyroid when someone presents with a cause, again, being cautious not to just blame everything on COVID. Chronic pain can be a significant challenge. Now, we do know lots of folks with Down syndrome tend to have a higher pain tolerance. But there's also a study that was done that indicated that in some individuals, they may have a higher pain tolerance for part of their life, and then at some point something changes and they may have a lower pain tolerance. We've seen a number of individuals with Alzheimer's disease, for example, who earlier in their life seemed to have a high pain tolerance, but as they developed Alzheimer's disease, their pain tolerance seemed to go down, and that was very challenging to address. So again, thinking of chronic pain, is there a potential painful situation here that may be contributing to the underlying, or be an underlying cause for the change in behavior? And then, of course, in our older folks, Alzheimer's disease we know is more common. Really thinking that this is pretty unlikely before age 40 in people with Down syndrome, but certainly as they get out into their 40s and particularly out in their 50s, we do see more Alzheimer's disease in people with Down syndrome. And it's often associated with a behavioral change. So just another thing to think about. And then in this individual, in this case example, medication side effects. It could be that a second medication was added that causes a side effect from the first one that the person didn't have when they were just taking the first one. It could be as they get older, they're tolerating a medication less well than they did when they were younger. It could be all sorts of reasons, a new medication, a change in dose or whatever. So certainly one of the things I always ask myself is, is this something I'm doing to the patient? Is there something that, something we've prescribed that may be contributing to this change that is important to consider? So as Katie mentioned, we're not focusing largely on behavioral change, but we did do a webinar a while back on behavior change, and that's available on our resource library. And then we have an article on that as well on our resource library. So in summary, we really want to think of, think broadly. Certainly COVID has been a huge stressor, and but we want to make sure that we're not overly focusing on the effect of COVID. We want to look at what other physical or mental health issues may be associated with or contributing to the changes. Is there a health condition that someone has sort of tolerated before that they're not tolerating as well now because of the stress of COVID? And so could certainly be a combination. Are there sensory issues? And Katie talked about whether there's a sensory issue that's contributing or whether there's a sensory intervention that could be helpful. And then certainly, particularly during COVID, lots of social stressors that could be contributing to this that we need to continue to look at to see what we can do to try to help individuals get through this challenging time. So some of the strategies that we've talked about here, but and some additional ones that we've seen families use successfully, just slowing down, knowing that this is a challenging time, and not expecting too much from ourselves, and just trying to function at a level that's doable is a good first strategy. Again, creating schedules and routines, sleep and healthy eating and physical activity. Again, this whole sense of mourning the loss of our typical routines, and those that have created new routines if need be, or modified their routines, seem to be overall doing better than those that have not been able to replace those routines. Using time to focus on health and wellness, as Katie, one example Katie gave, where the individual with Down syndrome and her family really have focused on healthy eating and exercise, and really have really corrected some health issues that were longstanding, that were not that could respond very nicely to this approach of really focusing on health and wellness. And a good family self-care, trying to figure out how to take care of each other, trying to address everyone's needs during this challenging time, and again, looking at our expectations on what's possible, and what we can do successfully during this time that's not overly taxing or stressful. And we've said this a few times, but I think this one really is worth repeating: limiting exposure to news and stressful conversations. And even at our own dinner table, at times, okay, COVID is no longer a topic of conversation during this dinner time. It's just, you live it all day long, and then you come home and talk about it all evening long. And that just really is not a healthy thing all the time. So, looking at, is the constant barrage of COVID news and conversation, part of the source of the problem? Helping with communication. As Katie mentioned, with Empathy Radar, and we know that folks are absorbing, individuals with Down syndrome are absorbing all that's going on around them, or much of what's going on around them, and helping individuals communicate that, and what are they feeling, what are their stressors. I've had so many individuals with Down syndrome come into the office or on Zoom visits or whatever, and say, the virus is how it's frequently termed. And how we know that from those conversations that individuals are taking all this in, they're taking much of this in and finding this stressful. And so, then taking that and developing relaxation activities, again, trying to put realistic expectations on ourselves, and making sure we're building in time to relax as well. And then again, certainly addressing any physical health issues. Again, all is not COVID. And we want to make sure that we're not overlooking other conditions. And then encouraging safe social interactions. We certainly do have some individuals that can't do a Zoom or can't do some sort of a virtual social gathering or whatever. But many of the people we see have done very well on these and have really enjoyed them. And particularly, Katie talked about some of the resources we have with regards to these virtual interactions. And Katie and Laura have developed some rules, if you will, for social interactions and ways just to make those be successful and be advantageous. And I'm going to ask a couple hypothetical questions. Really, I don't necessarily have the answers to these, but I think these are good for all of us to think about. And certainly it's something I think about for myself and our practice and our family. What have we learned from COVID? There have been some positive things we've learned from COVID, believe it or not. And what strategies and routines should continue. And none of this is truly unique to the pandemic. But are there things slowing down, more family dinners, taking more walks together as a family, connecting with family that live a distance via, I was thinking I'd never done a Zoom virtual visit with a patient, certainly, but even with family, I'd never done one before a year ago. And so, I've my extended family lives all over the country, and so the ability to connect with them in this way is been a real positive, and certainly something that I hope continues long after the pandemic is over. So really looking at that going forward, what have we learned, and what can we do that would be positive going forward as well as during the pandemic. So our resource library link is there, as well as our Facebook. We have a post on a daily basis. A lot of it is information about promoting health. And then our new email newsletter is available as well, and feel welcome to look at any of those sources of information. So I'm going to stop, and we'll open it up for questions. And I see there are some questions in the Q&A there.
Great. Our first question, what were some of the strategies that have been used to reduce anxiety?
Katie, you want to take that?
I was wondering. So I know that this question came in before Dr. Chicoine actually shared some of our strategies, but a lot of the good things to do to help reduce anxiety would be deep breathing, listening to music, drawing or coloring, journaling, watching TV. Any activity that someone finds enjoyable and that is relaxing can be used to help with stress and anxiety. And then the other thing that I failed to mention when it comes to sensory processing, and it's a strategy that we use at the Adult Down Syndrome Center, is to help make sure that our body is regulated so that we can face some things that cause stress or anxiety. So throughout the day, our sensory system kind of fluctuates like a teeter-totter, but we don't want it to have its highs and lows. We want it to stay really even and balanced. And so to do that is why we would have regular intervals of sensory input. And again, natural activities like chores and things like that can help regulate our body. And when our body is regulated, we are more open for changes in routine. We are better able to address things that cause fear or anxiety. And so sensory strategies can be really helpful. And again, those easy ones that we can naturally do throughout the day that get input into our muscles and joints can help with that. And again, we have a variety of strategies in our resource library to help with stress and anxiety, and that video is really, really helpful as well.
Next question. Some individuals use echolalia to process interactions by Zoom, so it's difficult with regard to the Zoom audio and Zoom sessions, social and otherwise, which have replaced so much of in-person time. Zoom has been good, but what would you suggest? Muting and unmuting is hard to do in a timely way.
Well, I know in our social skills groups, Dr. Chicoine had mentioned that we have group rules. And so one of the group rules is actually to have your microphone muted when you are not participating, because it helps to make sure everyone can hear each other. It limits distractions. Obviously, many of us are participating in Zoom meetings and things with other people in the home, and they could be making noise that can then be distracting. So we've just taught the individuals how to mute and unmute, and we can also prompt them where we click on ask to unmute, and then they just have to click on that instead of finding the mute unmute button. And then once they give us permission, we can mute and unmute for them. But honestly, anyone who works with someone with Down syndrome understands that they might need to process information slower or differently than we do. And if it, is because if they have to repeat it in order to understand it, most of us are pretty patient with that.
Okay. Have you seen an increase in symptoms of the co-occurrence of Down syndrome and autism right now? They shared my daughter's autism issues are impacting her life terribly.
Yeah, I mean, we don't see the little ones, so we don't certainly. I can't comment on, whether there's been an increase in diagnosis of autism. But I think what the question is some of the symptoms associated with autism, and I would think that. I think with anyone at this point, with or without autism, I think we've seen some of the stressors causing increased symptoms. So yeah, I would not be surprised at all that's a challenge. But I think, again, I think we've seen a lot of folks that have done well as well. So I think, going back and reassessing some of those strategies and seeing if there's how you might be able to address that in that individual would be important.
I have a couple questions about obstructive sleep apnea. It's an increasing concern for those with Down syndrome, as research is saying that a great percentage of persons with Down syndrome would develop it by adulthood. It brings with it behavior change, mood change, concentration, and memory issues. I find that practitioners do not automatically think of this for persons with Down syndrome and go directly to psychiatric treatment. This is the case for our son, who has, as it turns out, severe complex sleep apnea and was treated for several years with psych meds, which he did not need as soon as we got treatment for his sleep apnea. Can you comment?
Yeah, I would, I think it's something we definitely have to think about, with anyone that presents with a neurological or psychological or behavioral changes. I would agree with you. I think that is where, presentations like this and others that, there may not be physicians on this presentation, but the families certainly bringing information about sleep apnea to their practitioners is very important. And when we were working on the guidelines project, one of the questions I would get, well, how is this going to be? How do you know it's going to get into the hands of physicians? And my comment was, well, historically, in the Down syndrome community, families take that responsibility and bring the information to providers. So for better or worse, that's the reality. And so I would encourage you to keep doing those things. Because families are very good for advocating for their sons or daughters.
Can you comment on the incidence per research so far of sleep apnea in adults? And also, they had mentioned that the recommendations are to get a sleep study by age 4, but many persons develop sleep apnea later than early childhood. And families may be resistant to more testing over time if initial testing did not show that they had obstructive sleep apnea. What would you recommend?
Yeah, I don't think we really know for sure what the incidence of sleep apnea in adults is. I think it's frequent, but I don't know that we have an actual number at this point. Just because the studies have been relatively small. Some studies have shown well into the 70% plus, but those are small studies. That was a small study. But the number's big, and I don't think we really know what the number is. I think, unfortunately, a sleep study at some point being normal does not mean that the individual can't develop sleep apnea later. So it is something to consider if new symptoms arise. And it's, at this point, in the first round of healthcare guidelines that came out last fall, we did not address sleep apnea, but I'm very hopeful that will be part of the next round, as far as screening. But at this point, there is no universal screening recommendation for adults as there is for kids before age 4. But to me, any psychological or behavioral or neurological change, it's something you certainly should be thinking about.
Great. Where can everyone learn more about regression syndrome?
So there are a number of resources on our site, and on our resource in our resource library in-house we call it the hub, meaning we're developing a lot of resources, but we're also looking to see what others have developed and providing links to those. So hopefully that coming to our site and being able to find other people's resources as well would be something that you would find beneficial. There are some private Facebook groups for regression that you might look into, and we have information on those in ours that you can apply to. Lots of information on in our resource library, and there's a number of other organizations that are developing information. So, and again, it's a topic we're very interested in. So we're pretty frequently putting information up on regression on our website.
What are some good strategies to deal with self-talk that isn't negative, but can be excessive and completely absorbing the individual?
You want to deal with that, Katie?
I can certainly try. So like you said, we don't think that self-talk is necessarily a bad thing. But when it does get to be a little excessive, if they can't be in a private space to take care of that, if it's disrupting the family, or perhaps if they're at school or at work, then that's a good time to incorporate some calming strategies. So whether it's sensory input or giving them the opportunity to get away to do something, whether it's journaling or coloring or listening to music, because clearly they're needing to process something that's happening. And so we need to give them the time and space to be able to do that. Dr. Chicoine, anything else you'd like to add?
Yeah, I think that the key for us is that we don't think self-talk in and of itself is bad. So it's, and I think Katie said that as well, but I think that it needs to be repeated. No more would you not ask me at the end of the day for me to kind of think through my day, particularly on a challenging day. To ask a person with Down syndrome not to talk through their day would be comparable. I say to do that on the back of in the back seat in a Chicago city bus is probably not the most healthy thing, because that will attract lots of attention. But knowing where, again, what we call private space, doing it in your room, doing it in some other setting where you can do that, and privately, I think is a very positive thing. And we do encourage that. When people do lose the ability to discriminate the whens and the wheres, that certainly can be a sign that there's increased stress that may need to be addressed, whether that's physical or mental or social health issues. But in and of itself, it can be a very positive thing. And a lot of families actually find that their son or daughter will often talk more clearly when they're self-talking than when they're not, when they're talking to someone else. And some individuals will talk rather loudly in their room, and it could be a great source of information to the family. Boy, he's a little more animated with his self-talk today, and you kind of listen and find, oh boy, Jim at work was giving him grief today, so we may need to talk through that with them on how strategies to help him through that. So it can be a positive, but you're right. When it's indiscriminate as to where and how loud and when, that can be a situation that does need to be kind of addressed. And I'm a big fan of what I call a secret signal, where really try not to make it too obvious to those around that you're trying to encourage the individual that maybe this is not the time or place to do that. So families will develop a secret signal, and so they can kind of indicate to their son or daughter or brother, sister, whoever it is, you're kind of getting a little loud, or maybe this is the best place for this, and then the individual can discreetly go do that someplace else without the embarrassment of being sort of addressed publicly, if you will, with those around.
Okay, somebody else asked, the fact that an individual with Down syndrome has mental health concerns and hypothyroidism, Are you aware of any data that points that this might make them more likely to develop Alzheimer's disease?
It's a good question. No, I'm not aware of any data. We certainly do know that dysfunctional thyroid can look like Alzheimer's disease, but I'm not aware of anything that suggests that having had thyroid dysfunction lends itself to actually developing Alzheimer's disease.
Any thoughts you can share on introducing calming strategies when the individual gets mad when you try even when in a calm state?
Sorry, I just need to hear that or see that again. Yes, so in our groups, we talk about triggers. And so a trigger is any kind of activity or event that occurs that makes us feel a certain way. So understanding what the triggers might be can help so that you can anticipate that they might be getting worked up, and you can try to introduce a calming strategy before that. Obviously, if someone is already in a state where it might not be safe to engage with them, you just want to make sure that they are in a safe place where they can't hurt themselves or somebody else. But that's really why we want to think about our body kind of as that teeter-totter that I had mentioned before. And when our teeter-totter is even, our threshold is higher. And so we can tolerate more. And so again, those regular intervals of sensory input throughout the day can really help make sure that we have that higher threshold. So fewer things bother us. When things do bother us, they don't bother us for nearly as long. And we would be able to introduce some alternative calming strategies at that time. And then, oh gosh, I had one other thought in my head about calming strategies. And I apologize. I kind of have COVID fog, even though I don't have COVID, but all of these Zoom meetings are doing that to all of us. Oh man.
We can certainly come back.
Yes, please. I apologize that I can't think of the last thing I wanted to say about the calming strategies. Thank you.
I would add that, those resources that Katie and Laura are working on developing and posting, those are things that it really can take sort of the responsibility out of the hands of the parents, if you will. And so because sometimes just, trying to interact when the person's angry is just going to make the person more angry. And so directing the individual back to the resource, and the resource is really to introduce the resources in the middle of an anger episode is not going to be healthy. I mean, not going to be likely successful either. So it's something to look at before and practice potentially before as well, ahead of time.
Yep. So I remembered what I was going to say, and it's the use of visual supports. So if we can limit the amount of verbal cues that we're providing, and we can show a visual cue, that might also help in a stressful scenario. And then, like Dr. Chicoine said, creating a plan. So one of the other resources we have is a visual handout that says, like, when something, and you fill in the blank of makes me stressed or angry or anxious, and you create your plan of like 3 different things you can try. And so if they create this plan, they just know that if they're feeling that a certain way, that they should try one of those activities. And then you might even be able to casually suggest one of those because they've already created the plan for what they would do if they felt a certain way.
Wonderful. Someone else asked, my daughter has started to refer to herself in the third person. How do you know if this is a language issue versus maybe a mental health concern?
Well, that is a wonderful question. I'm not sure I have as wonderful an answer. I think you'd really want to look at, if you have any question that there's a language issue, I think having the person evaluated by a speech and language pathologist would certainly be a good approach. But again, I think, looking at, are there other mental health issues? Are there other symptoms? Is there something else that would suggest that this is a mental health issue? So I think you really got to go back and look at both. And is there a potential stressor that may be contributing to that? So I think you really got to kind of look at that broadly. And unfortunately, there's probably not an easy answer to that. You really have to kind of look at all those areas to sort through.
All right, we had one last question, and this may be a tricky one. So will things improve when normal life returns, or maybe some strategies to consider to see some improvements when we do hopefully get back to normal in whatever way that whatever that means.
I'll start, Katie, but I think it'd be good for you to talk about this as well. I think that, we want to look at the thing, again, kind of the slide just before this one. We want to look at what are the things that have worked well during this. I think we want to look at that for many people, it isn't going to magically go back to normal. There may be the same issue in reverse that we got into the pandemic. We may get as we get out of the pandemic. So now the schedules have changed again. And so, we probably are going to need to do, and lots of individuals do some planning again. Look at our opinion is that the visual schedules are so beneficial. And, develop some here, here's what the new schedule or the new old schedule or whatever the case may be, whatever it's going to look like, here's what it's going to look like going forward. But start to prepare for that, I think is important, because I do think that we are going to see some individuals, have some challenge going forward. And I think, the other thing I'm reading articles on other individuals, not anything to do with Down syndrome, but, a lot of us have sort of held it together just because this, it's been so intense, but as it does become less intense, we are beginning to, to sort of, maybe the adrenaline rush is leaving, or whatever you want to call it. And we're beginning to struggle a little bit. So I think we do need to start to prepare for that and look and, develop some strategies to come out of it, as well as having gone into it.
No, absolutely. And I think the advantage we have here is that we can prepare for life after COVID, where we were not able to prepare for life with COVID. It just, practically appeared overnight for some, and everything shut down. And so we can use this opportunity to create those schedules, to start practicing. We know individuals with Down syndrome do well with practice and repetition. So let's say they haven't been working for the past year, and so now they're sleeping in and they're doing all these things and they're out of their routine that they're going to need to get back into. So we create that visual support, or we go back to that old routine, like Dr. Chacoin said, and we start practicing it. We start practicing getting up earlier and what's all the things that they have to do to get out the door in order to get to school or work or whatever that might be. But I think we should use this as an opportunity to better prepare them, because we weren't able to do that at the beginning of COVID.
And potentially to, what are parts of the old schedule that weren't ideal? What have we learned during this that we would like to implement into the new old, whatever, however you want to phrase it, schedule? I think there's opportunity here as well. Okay,
we had one other question come through. My child has phrases that she repeats often. If we don't answer her exactly, she keeps asking, how do we stop these habits that are more repetitive?
I can start with that. So certainly it's, what is the phrase, and what is it? Is it something someone's asking? Is it, just a statement of something? What is the goal, if you will, of the communication? And maybe there isn't. Maybe that's just. But oftentimes there is. And again, we've typically found some sort of visual strategy is helpful. So, for example, one individual got a little notebook and wrote down the number of times that she said a statement. And she would look at that, and that was very eye-opening to her at the end of a day, and say, holy cow, I said that, 63 times or something. So, that was just to help that individual understand what they were doing. Other individuals, it's a question, or it's a, sort of a statement of need, if you will. And again, that's where developing visual schedules or visual reminders can be very helpful. I'll just give an example. What time are we going to the store? And if you've made a visual schedule ahead of time, you can say, Jill or whoever, Jill, we talked about that and it's on your schedule. Why don't you go take a look at your schedule? And so, you're answering the question, but you're not answering the question, and you're giving the individual the responsibility for finding the answer. And hopefully over time, that individual will then also know that they don't need to ask the question, and they can look at the schedule as well. But again, for a lot of that, it's just reducing the interpersonal conflict is probably too harsh a word, but interpersonal stress, and putting that interpersonal to a picture schedule or whatever the case may be is often very helpful. Katie, you have something else on that?
Yeah, I was just thinking, I mean, depending on what they're saying, I mean, I know this particular person gave an example, but what's the intent behind the communication? So are they saying that because they really mean something different? But then also, if you look at this with a true behavior only focus, when you're responding in the way that you are, you're actually positively rewarding their negative behavior. Like if you don't want them saying that, you're just encouraging them to continue to ask that because you're responding. And so you're actually encouraging that behavior. And so if you were to step back and not respond, then you're going to phase out those questions. But I really do think it's figuring out the intent, because clearly they want to socially engage, and trying to figure out if they can do it in a more positive way with different language.
Okay. Really quick before we wrap up, do you have any suggestions for a website to make a visual schedule quickly and easily?
Well, so I use Boardmaker, and Boardmaker is actually available online to families. You can do an online subscription. It's $99 a year. You can also do it month to month. So if you only wanted to do it to make one visual support, you could pay, let's say, I don't know the exact amount, but $20, and then you just use it for the month and you make whatever visual support you want. The other great thing about Boardmaker Online is that there's a community of resources. So you could get on and see that someone else has already created that exact visual, excuse me, that you were looking for. And then you can just download it and print it off, and you don't have to create your own at all. So it's not free, but it is affordable and easy to use. So I would honestly recommend looking at subscriptions of Boardmaker Online.
Wonderful. Well, thank you, Dr. Chicoine and Dr. Frank, for sharing such valuable information with us today. And thank you to everyone who was able to join.
Thank you.
Thank you for inviting us.
Have a wonderful rest of your day.
You too. Be well.
Thanks.